Right, good afternoon everyone and welcome to today's webinar. We're pleased to have Kate Field with us today, who is our Head of Information and Intelligence, and will be delivering this session. I'd also like to welcome Julie Farmer, who is the Networks Manager for IOSH Groups and has kindly agreed to join us today. Before we get underway, I just wanted to mention a few things. Firstly, for those of you who haven't attended one of our webinars, I'm Ben Pollard and I take care of the technical aspects of these sessions. Any problems and I'll try to assist as best as I can. On your screen, most likely at the top left-hand side, you will notice a small bar with some written options on them, which are chat and Q&A. If you have any technical issues and need to message me at any point, please use the chat option. If you have any specific questions for Kate or Julie relating to the content of the session, please use the Q&A option and ask your questions here. You can open and minimize these boxes at your own leisure, so should a message be sent out to you, it will flash orange. So with all that said, I shall now hand you over to Kate, and I hope that you all enjoy the session.
Hi, welcome to our first webinar focusing on translating our research into practice to help and enhance the role of occupational health and safety professionals. Before we start, I thought I'd do a little bit of an introduction about myself. I'm a chartered member of IOSH and I've been a health and safety professional for over 18 years now. I started my career working for the Health and Safety Executive as an inspector, and then I moved into their programme work, particularly focusing on health issues. So it's a particular area of interest for me. And then I went to the other side and I went into private industry and I worked as a consultant for a number of years, including running my own consultancy business. I have experience in most industries to a greater or lesser extent, public, private, third sector, SMEs through to large global multinationals, so quite a range. I joined IOSH as Head of Information Intelligence, which is a great job title. It makes me sound a little bit like a spy, but I will tell you what I do in a second, at the end of April last year. So our information and intelligence unit is actually made up of two teams. It's our research and development team, which focuses on research, as the name suggests, and what we're talking about today. And then the other side is our technical support team, and they provide a number of services to IOSH and our members and other external stakeholders, and in particular oversee the production of our many free resources and guides. From a personal point of view, looking at today's content and subject matter, when I was working as an occupational health and safety professional, I've actually had experience in terms of supporting a number of people while they've been undergoing treatment for cancer. So it's something that is close to my heart in terms of being able to support them. So this is my first webinar. Although I do lots of public speaking and training, this is my first actual webinar, so please be nice. Thank you. So just to get us going this morning, I just thought it would be useful to have a bit of information about you guys out there, our audience today. So just have a quick couple of poll questions that I'd like to ask, please.
Okay, so hopefully you'll all be able to see the polls on your screen. So if you have to go ahead and fill out those answers, that would be great. We'll leave the poll open for a few seconds until we've got all the votes in, and then we'll display the results.
Okay, we're nearly there. It's just useful to understand who we've got on the other end of the line, so to speak. Great, lovely. Thank you very much for that. Really appreciate it. So in terms of the content for today's webinar, I'm going to give you just a brief introduction to IOSH's research programme and why we fund research. I'll obviously then introduce the research that we're looking at today in terms of return to work into cancer and how it was done, and then of course we'll start to look into the details of the findings from that research and specifically what it tells us about what employers can do to help facilitate those undergoing treatment or returning to work after cancer, the health and safety implications of returning to work or staying in work, and what some of the good practice health and safety issues are that we need to look at. And then we will have a Q&A section at the end. Ben's already said that you can obviously ask questions as we go along, but we will save the answering until we get to the end, if that's okay. So in terms of our funding for research, it comes very much in terms of achieving our charitable aims, which are set out on the screen there for you. It's very much about ensuring that IOSH has the ability to have impact and influence within the global OSH community, and that we provide intelligence to our members to help them achieve their job role within the workplace. So it covers a number of things. We actually use our research in a number of different ways. We will use it to help inform some of our key activities. So for instance, NTTL was based on research, although it wasn't research that we commissioned. You know, we will look at research to see, you know, the key areas we should be focusing on. We will use the research that we actually fund directly to influence governmental policy. So for instance, the current green paper that the government have out looking at disability and return to work, you know, we've responded to that and indicating some of the research that we've undertaken. This one, for instance, and some other research we've undertaken, particularly looking at the success around the fit note within the UK. We will also use our research to enhance what we can offer our members and the profession more widely in terms of actually evidence or tools to actually help people get on and do their job. And it's also important to understand that all our research is always peer reviewed to ensure quality. So why did we fund this research? We have a very thorough process associated with making decisions about funding our research, and that includes having an expert panel which is made up of academic researchers and practitioners that assesses all our applications for research. So we always look for high quality research that will enhance OSH knowledge. So in terms of this research, we understand and we know from other research that we've done and other organisations have done that work is good for health and that keeping people in work is good for business. But with an ageing population and the changing to the length of working life, so things again like in the UK where we have an increasing retirement age, we are likely to see an increase of people having a diagnosis of cancer while they're in the workplace. Rough guides in terms of figures is that by 2030 it's estimated that 23.6 million new cases of cancer will be diagnosed worldwide, and around 41% to 84% of people who have a diagnosis of cancer will return to work. So we need to ensure that businesses, and from our point of view in terms of being OSH professionals, we understand what the key issues are so that we can help people successfully return to work. So This research was particularly looking to focus on a gap in our knowledge, which is related to specific evidence on the health and safety issues associated with undergoing treatment or returning to work. So that's why we chose to fund this. So the research itself was run jointly with 3 institutions. It was led by the Institute of Occupational Medicine, with Loughborough University and Affinity for Work at Health. So in terms of just a very brief overview in terms of the structure of the research, if you're familiar with academic research, it follows a fairly standard model. It started with a systematic review, so this is very much a literature review, and this allows the research team to identify other sources of publications or research that might be relevant to this study. Each publication is then reviewed and assessed for its quality based on a recognised methodology. So in terms of this project, 609 different sources of information were identified and evaluated. 17 were included within the actual review for this research, with an additional 40 identified as having some relevance. So that provides really a baseline of knowledge and intelligence. Then the second stage of the research was really looking at case studies, so real life experience, and this builds on what was found in the literature review, and it helps provide structure to the interviews and the interventions in relation to the case studies. So with the case studies themselves, there were a mix of large and small and medium-sized businesses. There were 8 organisations identified in total, 4 large organisations, 3 medium and 1 small. And then the last element of this research, which we'll come to towards the end of today's presentation, is the development of guidance to help and support employers, employees, and in particular occupational health and safety professionals. It's probably worth mentioning at this point that there are, as is perfectly normal with all research, some limitations associated with the research. For this piece of research, it was really around the case study element. Because it's such a small sample size, it can be quite difficult to get the engagement of organisations to take part in research, and particularly when it looks at health issues, because people obviously feel quite sensitive and vulnerable about discussing some of these. So it was quite a small sample size, but there is useful intelligence that's come out of it. It did focus on a predominantly female workforce in low risk environments, so principally office roles. So I think we can use the findings from the research to extrapolate through into different situations, but it is something to be aware of. The final point just to bear in mind is this was a cross-sectional research and not longitudinal. So that means that it took a snapshot in time. It didn't actually look at these organisations over extended period. And what that means is that some of the findings that suggested that employers have a lack of awareness about the longer term implications could be explained because the research didn't have a chance to see what happened in the organisation after the research. So in terms of moving on, what did our research actually discover? So the research was focusing on what employers can do to facilitate people to stay in work or return to work after or when they are undergoing treatment for cancer. The key finding is that it needs an individual and tailored, flexible approach. It confirmed what we already know or should be aware of in terms of actually having effective sickness absence and rehabilitation practices in place are incredibly important. And a key part of that is regular and effective communication, particularly between the line manager and the individual involved. It found it was very important to actually have a written return to work plan, and Interestingly, within the research, it did suggest that it would be sensible for organisations to have a policy about cancer and support that was available. I think from our point of view at IOSH, when considering these sorts of recommendations, we need to be careful about having a policy for everything. I think it's very important that organisations have a clear policy and process around supporting people with rehabilitation and coming back to work, but this should cover all types of injury and illness, be that physical or mental. I don't think it's necessary to have an individual policy for cancer. You know, we are seeing, particularly with an ageing demographic, that there's an increase in terms of chronic conditions, and they need long-term support in exactly the same way as cancer may need to do. Flexibility I've mentioned, and you know, there are a number of elements associated with this, but particularly in relation to cancer, fatigue is a big issue. So having the ability to vary start and finish times, or permitting people to work at home, can make a huge difference for those individuals and their success in terms of returning to the workplace. It's also important to have and a focus on individual risk assessments that are regularly reviewed. Quite often, for people undergoing cancer treatment, you know, they will go through cycles of treatment, and the impact that that treatment has will vary. So, you know, doing a single risk assessment at the beginning of treatment is not necessarily going to be relevant all the way through. So it is important to have detailed risk assessments and review, but we will come back to risk assessment. It's obviously important to consider the management of workload, and this may be where you integrate your processes around rehabilitation and supporting people with cancer with other processes that you might have in place. So particularly around stress management, for instance, when you're looking at workload and any potential issues in terms of pressure points and workload. It is, of course, important that people have information and training to understand what the issues are, and this should specifically look at line managers, HR professionals, and of course ourselves as occupational health and safety practitioners. It is also important to understand the longer term impacts of cancer and its treatment, and what that means for return to work. This was something from my own time in terms of supporting people with cancer that became very very obvious to me in terms of helping supporting those individuals. Quite often, you know, line managers or even HR professionals will assume that when somebody returns to full-time work, that's it, job done, nothing more to do. But actually, there can be much more longer-term impacts in terms of both physical health complications associated with the cancer treatments. Quite often it will have longer term ill health issues. But for me, the thing that I found had the greatest impact was the psychological side of things. Quite often for those who came back to work after a successful treatment plan, actually found that the mental impact hit them at that point. They were so busy up until that point dealing with the physical treatment and the physical implications that actually kind of almost a delayed shock reaction came in after they completed their treatments. The other point that's worth mentioning, or I think is worth mentioning from my personal experience, which doesn't come out from the research, is that quite often people feel very are very anxious around key anniversary dates or checkups that are due. You know, with cancer, it's very common that, you know, people will have an annual checkup, and obviously they become nervous and anxious about what the outcome of that will be. So this is something to consider, you know, that actually ongoing support may be required. So it's probably just worth mentioning that our research did indicate that there can, of course, be some barriers in terms of people staying in work or coming back to work when undergoing treatment. The job itself, so this is very much around, you know, physical demands that might be associated with the job, may mean it's simply not practical to be able to stay in work, or there may be, you know, modifications that are needed. Again, the psychological aspects of the work, you know, the work demand, you know, it may be that, you know, in normal circumstances, the job demands are fine, but when somebody is undergoing cancer treatment, you know, they've got a lot going on in their lives and they may not be able to focus on work in quite the same ways. There are, of course, symptoms that arise from the illness and the treatment itself, in particular for cancer, around fatigue and infection risk. So for something like infection risk, if the job role is focused on dealing with the public, then that can have, you know, limitations because of the potential infection that, you know, may be passed on from those dealings with the public. So it's something to consider. The other thing, although it was very limited, was there was some evidence that there were increased risks to health and safety for those undergoing treatment. This was really around the fatigue and potentially the medication, and the fact that it, you know, it made some individuals more physically weak, and, you know, there was a potential for an increased risk around slips, trips and falls, for instance. So in terms of the health and safety implications, so really the focus for this research, it identified a number of key areas. It is important to have an individual risk assessment process. Now, this doesn't mean that, you know, a full written individual risk assessment needs to be done. It may be that, you know, key points can be captured on the return to work plan. It may be, and I noticed that quite a few of you listening today have access to occupational health services. It may be that within the context of an occupational health report, they may make some recommendations for risk assessment, and then it may come to you in terms of your role as a health and safety professional to actually review some of the individual risk assessments or implications. Certainly for me, that was very much what I found. Or actually, to be honest, it was more of a mixture. I think in some cases, I was having confidential conversations with individuals who wanted support, and I was identifying whether there were modifications that we needed to make to help them stay in work safely. In other cases, I was working with occupational health professionals to identify some of those issues. But in terms of key areas that should be considered, then we'll just run through the key ones that came out of the research. So obviously looking at physical demands and limitations. So this has two elements really. Potentially, while somebody's undergoing treatment, they're going to be less physically able to do certain aspects of the jobs, particularly manual roles. The other element is that if people undergo surgery as part of their cancer treatment, then obviously that might have limitations in terms of what they are able to do. Certainly, it may be in the shorter term. Some of the case studies that were looked at within this research found that very obviously. So things like, actually for breast cancer sufferers, you know, working at a desk and at a computer can become more problematic because of the pain that causes. So those aspects need considering. So it may be that you need to do an ergonomic review or a job design review. So, you know, typically within low risk environments, you know, that might be reviewing DSE, display screen equipment assessments. You obviously need to consider, and we've touched on this already, but the psychological demands of the role. This will need to look at, you know, what the individual's role is. So if they are a manager, the level of work, you know, the demands that are placed on them, and modifications may be needed. And it may be that, you know, certain activities are taken off their workload, are given to somebody else. They may be moved on to more project work that has, you know, more flexibility flexibility maybe around timings for delivery. So it's all the aspects that if you're looking and working through stress management processes within your organisation, you'll be asking the same questions here. We've touched on the fact that the impact of fatigue and medication needs to be considered. The medication can affect concentration and decision making, so that needs to be highlighted in particular. Related to fatigue as well, you need to consider things like traveling and access to and from work. So, I was having very practical conversations with individuals I was supporting about how they got to work, how long their journey was. Actually, were they fit to be driving in the car for an hour? What were the alternatives? Did they want to be on public transport? And then it was very practical things about when they got to work, could they park at the front entrance so they didn't have to walk further, use a disabled access bay. And again, working at home can really help address some of those options. The other thing to consider, particularly with cancer, is requirements around welfare facilities. Quite often with some of the cancer treatments or surgeries associated, individuals may need to use the toilet more frequently. So, do they need to be relocated so they can get to the toilets? Are they on the right floor, or the toilets on the same floor that they're working on? Because going up and down stairs might be complicated. So it's very practical things like that. Considering breaks in the work day, and we've touched on hours, will help in terms of managing in particular the fatigue. So as much flexible working as possible really benefits the individual and really helps their successful return. The other thing just to consider, and this may not fall to you, so it may be a question that you liaised with maybe your facilities team or whoever looks after fire and evacuation processes, but you need to consider whether a personal emergency evacuation plan needs to be put in place. So somebody who's undergoing treatment, they may not be able to move as quickly as other members of staff. They may be more unsteady on their feet. So, trying to get out of a large office block, which includes a lot of stairs, they may need support and, have somebody allocated to help them get out. So there are a number of issues that need to be considered in relation to that. It's probably also just worth highlighting that in many countries, equality legislation does actually cover cancer, and that will help support in terms of decisions and needs around reasonable adjustments. So it is something that's worth considering within the context of supporting people. And I think, the other point to consider is that although this research was very much looking at cancer risks, actually a lot of these best practice approaches that we've outlined here are just as applicable to other forms of ill health and mental ill health. Things like flexible working, thinking about travel and access, fatigue, psychological demands, they're relevant to all forms of support for those who are physically or mentally ill and trying to stay in work. So there's just a couple of points that I wanted to flag that didn't come out specifically of the research, but I think when we are considering our role within an organisation are worth mentioning. So the first point is around considering whether the individual is in a safety critical role or not. Where they are, it may need a more in-depth individual risk assessment or greater consideration of what work they should be undertaking. And I think part of this is also understanding the implications of any error that may be made by that individual within their workplace, which has the potential for increasing risk either for themselves or for others, or it becomes potentially what we would call a latent or hidden error. So that sort of thing might be somebody who's a designer or does chemical analysis and is making calculations or formulations, and if they make an error in those calculations or formulations, it can potentially have very significant consequences in terms of health and safety. So it is an area to consider and explore. And the last point really is a little call out for anybody, I think, who's helped or supported anybody with cancer, is don't forget about those who are caring or supporting those undergoing cancer treatments. Actually, particularly the psychological impact that supporting people with cancer can have means that, they often need just as much help and support and flexibility at work as those who are actually undergoing treatment. So we'll come on to some of the tools that are available on our website as a part of this research, and that does include the 8 case studies that were actually done as part of this research. But rather than go through those, I'm really pleased to be joined by Julie, who works here at IOSH, to bring about, I suppose, a personal case study and, talk through some of the issues and challenges and successes that she has formed. So welcome, Julie. And Julie, would you mind just sort of introducing yourself to the audience and giving us a kind of a view of your position, please?
Thank you, Kate. Yes, hello everyone. When Kate mentioned this webinar, I realised that I'd actually managed a colleague back into work following treatment for cancer. I'm a line manager here at IOSH. I then supported a colleague through second cancer and successfully back into work. Alongside that, a colleague who became a really good friend through terminally ill cancer. And then just through friends of friends, I've supported 2 others through text who I've never actually met. But for me personally, as I said, I'm a manager here at IOSH, but a couple of years ago, I went through diagnosis completely out of the blue for cancer and did a very successful return to work. Well, I hope my colleagues think it was successful. I'm also a carer for a close family member with cancer, and unfortunately now, I don't know, perhaps not unfortunately, because you do gain strength through this. I'm now going through chemotherapy for a second cancer. So, but despite all of this, I think the one thing that I really want to make clear, and Kate's touched on this, is for me, it's to remember to explain that if you're in any situation, is to explain that you are still you. I'm still a person. Yes, I'm a person who's had cancer, or you might be someone who's being treated for cancer, but you're not a cancer patient at work. You're still you, and I need, and I'm sure anybody else needs, the normal stuff to continue. This may sound really silly, but for me, it's my only way of keeping some tiny bit of control and beating this. So for me, the big question, and I think Kate's touched on this a number of times, is who and when do you tell? Because this thing is such a phenomenal blow that comes out of nowhere. And for me, this is difficult because you only find out your treatment, and I can only talk about myself, your treatment and your diagnosis in stages. So I've not actually got dates for certain procedures. And you have to be comfortable to talk to your manager. But if you don't, how can they help you? And for me, the best thing is to learn together. It's to use the resources, whether it be this research or reputable websites such as Macmillan. And this will be new to you. It'll be new to your line manager and your colleagues. So take that journey together, and don't forget your healthcare professional team. They are amazing and can give you some really good support. For me, I also supported someone who was going through cancer, and on both sides of that, it's when you're asking someone, ask them in private and agree what it is they want to share, when and whom with. I decided to go public because it was obvious. My hair loss meant it was obvious. Everybody knew my treatment regime. I work in an open plan office, so I would disappear. but it does take courage, and it is very personal, and it is very difficult. So please have those confidential conversations. And it is a learning time that need to find out about your employment policies and processes. You probably won't have them in place because you'll be the first one to travel this pathway. But by getting people back into work, it's valuable for all concerned. And this doesn't just apply to cancer patients, as Kate said. It's all returners to work. So let's share that good practice and have those conversations, those risk assessments, and look for other channels of support. My place of work have put me in touch with other areas that have supported me and given me that guidance. It's a huge journey, so please take it in stages. Everyone's different. I can only talk about me. Some things will impact on your work, some things won't. Each person, as Kate said, is an individual, and each journey is an individual. I'm a very practical person, so I would say please write everything down. There's so much stuff going on in your normal work life, your personal life. You then get diagnosis, you get treatment, and as Kate said, the drugs just take over. They do strange things to you. So please, it's like getting another full-time job. Write things down and get agreement over who does what and when. So you've got one less thing to worry about, not just you, but your colleagues. And I really appreciate my colleagues, and it is hard to accept the help, whether it be a lift into work or someone just to walk through that door. That front door can be really scary when you come back. And I needed that support. And I got that support today just to get me in here to do the webinar here with Kate and with Ben. And they're sitting here nodding at me because it is a very personal and scary thing. Don't expect everyone to be helpful. Not everyone can do the right thing at the right time. You will get some hurtful comments and you'll think, what on earth's going on? So just take a deep breath. However, I found support from people I would never have imagined, never initially thought of. And the strange thing is, to accept the kindness does bring on the tears, and it is hard to deal with it, but please accept it. And just finally, from a personal point of view, what I've learned is communication is the key. But you must have your support from your work environment to do this. And Kate's given some good examples of her personal stories of supporting people to return to work or just to open up about it. And for me, the open discussion about cancer and taking away a tiny, tiny bit of that fear and control it exerts is all I can do to beat it. And you can only beat it together. And survivors are stronger, better people. And it's going to sound ironic, but you learn multitasking skills, diplomacy, strength, and so many other transferable skills. So that's really all I can share from me. And I hope that's been useful, and I'll hand you back over to Kate.
Lovely. Thank you, Julie, and thank you for agreeing to come and chat to us. I think in terms of touching around the support requirements, I think when I was helping those individuals who were undergoing treatment, it was different for everybody. So it comes back to this point around the individual and how much support they wanted at work, what level of information they had. But one of the things I found quite interesting was exploring with them, what support mechanisms they had outside of work, and helping them make the connections to make sure that they were getting support outside of work. I was lucky enough in the organisation where I worked that we had an employee assistance programme, which offered talking therapies and counselling support, and I was able to encourage the individuals that I was helping to make use of that, and I know that many of those who did found it invaluable. But it is worth remembering, and certainly the hospitals, the treatment centres where people are undergoing treatment, they will have access to a huge number of support mechanisms. Macmillan Cancer has some amazing advice and support that's available to those who are undergoing cancer treatment, but also for carers. So you don't have to go through it alone. There are sources of information out there. So I wanted just to move on and talk about some of the resources that are actually available off the back of this research. So I'm hoping that all of you listening are all fully aware of the amazing free resources that IOSH offer, and one of those is our Occupational Health Toolkit. This covers both occupational and non-occupational health issues, and it provides a number of key information sources, but also tools and checklists and example risk assessments. You know, there's a whole range of information. And under the non-work related conditions section, we have put the return to work after cancer guidance section. So within that, there is checklists in terms of things to consider for those who are undergoing treatment or returning to work. There are example risk assessments. There are all the case studies that are captured that came out of the research, which again highlights some practical implications. So, you know, a really useful section in terms of a resource for you. It's also worth highlighting one of our other free guides, which is a healthy return, which focuses on rehabilitation processes. It covers work-related ill health and accidents, stress and mental health, MSDs, and also maternity. And again, this includes case studies, a 12-point action plan for occupational health and safety professionals, and again, templates in terms of things like a work adjustment form. So very useful resources. And of course, you can read more about the actual research that this webinar is based on. So within our free, within our books and resources section of our website, you can click through, you can download the summary report, which is the basis for this webinar. And if you're keen, you can read the full research report. Both of those are available free to download. And I couldn't do this webinar without talking about prevention. So although this research was focused on cancer, whatever the cause was, of course, as occupational health and safety professionals, you know, we aim to prevent cancers that arise from work. And of course, we have a number of resources that are available to help and support with that. There is, of course, our No Time to Lose campaign, which looks particularly at solar, diesel and silica risks. But also within our occupational toolkit, we do have a whole section which is dedicated to occupational cancer. So a number of resources to help. So just a chance before we move on to the Q&A section for me to catch my breath, if that's okay. We just have some further poll questions that we'd like to ask you, please.
Yep. Okay, so just before we go on to the questions, we're just going to launch a quick poll with regards to sort of feedback about the general running of this particular webinar. So if you would just take a few moments just to go through that whilst we have a little look through some of the questions, and if you could respond, that would be great, and then we'll get on to some questions. Okay, excellent. We've still got a few more to come in, but what we'll do is we'll leave the poll open anyway, and we'll now go on to some of the questions. So, Kate, over to you.
Lovely, thank you, Ben. So our first question is around at the beginning of the webinar. I said it was a small sample size. Can I give an indication of numbers? So I did cover that, but just to confirm, there were 8 organisations who were involved in the research, and that resulted in 8 individual case studies. So it gave a cross section because it was included large, medium and small businesses, but it was only eight organisations. But I think looking at the findings that came out of the research, and looking at other either best practice or other research that look at rehabilitation, supporting people returning back to work, whether that's cancer or other forms of physical or mental ill health, actually we've got a consistency in terms of best practice and areas to follow. So our next question is an interesting one. How would open plan offices likely impact on infection control? Julie and I had a little giggle about this earlier because I have a slight, well, actually it's cleared up now, but I did have a slight snuffle over the weekend, and I did say to Julie, did she really want to be in a small office with me if I was going to breathe germs all over her? And I think, it's about being realistic and proportionate and sensible risk. When there are colds, there is always a risk in terms of people picking those up, but there's often a misconception that this is it's through the air, but it's not. Of course, it's principally germs that are left on surfaces, and this is really where it comes back to having a sensible discussion with the individual, and that individual having conversations with their medical team in terms of what the likely level of risk is, and making some sensible and informed decisions around that. It doesn't stop people from being in work. Julie's here, with all the various germs that are around her. So it is around, sensible risk approach, and having a conversation with the individual. Julie, would you like to add anything?
Thanks, Kate. I think for me, it is actually also remembering that I've got a lot of things on my plate at the moment, and to, as an individual, take that advice that you're given from your colleagues. So if it is sensible for you to move into, and if it's practicable, move into another office, just do the general basics of good hand hygiene, but also to actually have the ability to, if somebody says, look, you need to be working away or you need to take some time off, then listen to that. But again, it's that open communication, it's that conversation that you have. And as I said, I'm learning as I go along. It always makes me smile that my healthcare professionals keep saying, are you sure you're still working? And then they expect me to go back and sit in a hospital all day, which is full of poorly people. So it is being practical. And I think also for me, I'm not an expert in this field, but I don't want to isolate myself. So it is making sure that you do keep your immune levels up and you are sensible and practical, but always keep your ears open to the good advice.
Lovely. Thank you. So our next question, we talked about training for line managers. What types of training do you recommend for line managers for them to be able to confidentially manage and support employees who have been diagnosed with cancer and the treatment, etc. afterwards? Online, face-to-face, are there any organisations that you are aware of who provide this? So I think, again, for me, I mean, there is some more detail around this that came out of the research. So you might, and that's available on the IOSH Toolkit. I think, again, for me, and from an IOSH point of view, you should be managers to be provided with good training, and my personal view is that face-to-face is always best, and certainly my experience is when you're looking at health issues, that is better, because quite often when you are trying to help managers understand how they can help and support their employees, a lot of a lot of the issues are around fear about what to say or how to approach a conversation, and you can only do that and overcome some of those fears and some of the misconceptions that there are by having a conversation around it, but I think in terms of looking at specifically for training, it should be part of training that looks at rehabilitation and support, whatever the type of illness, whether it's physical and mental. Again, I think there's always a risk of saying, oh, we need something specifically that addresses cancer. But as we've already touched on, actually, this research has shown that it's all about best practice approaches to rehabilitation, full stop. Yes, there may be, one or two key areas that need to be considered in relation to cancer, but actually it should be about the overall approach. In terms of organisations that provide this, quite often, for those of you, and there were quite a few of you listening that have access to occupational health providers, they'll quite often be able to do training around rehabilitation. Here at IOSH, and Julie's been in touch with, Julie, can you remind me of the organisation that we use?
My colleagues put me in touch with an organisation called Working with Cancer, which helps people to return to work either during cancer treatment or following cancer treatment. And that's provides support for both myself and my line manager.
Great, lovely, thank you. So our next question, taking into account people get more fatigue than others do, we need to put transport on for people coming into work, because if driving, we still have a responsibility to get them into work and home. So I think this is a really good question, and again I've had some personal experience around this. So I think there is an important element to be asking the question to the individual about how they do get into work. Is it safe for them to be driving or to be on public transport? And then having a discussion about how you manage that. In terms of some of my personal experiences, we've had a combination of things. We've had some people where what we've done is help and support a change to their hours, so coming in later and leaving earlier so that they miss rush hour, which can help reduce the level of commute. I've actually been lucky enough, and it might be a possibility, but it's very much, depends on the organisation and where the individual lives, where they have been offered taxis, or quite often, don't forget the kind of pool car stroke, the colleague who lives down the road, and will they, would they be willing to give them a lift into work? So again, it's about having that conversation. So our next question, why didn't we work with Macmillan Cancer Care on this study? So actually our research team did have interactions with Macmillan Cancer Care on this study, and certainly some of the in terms of the first element around the literature review, in terms of what was out there, Macmillan definitely focused in that. And we have actually been in contact with Macmillan in terms of the findings for this research to see whether we can help and support each other. Macmillan have some great resources in terms of information for employers and also those undergoing treatment, so I think there's a real overlap here. So Macmillan were not, I wouldn't say directly involved, but certainly we did touch base with them, the research team did anyway, and we are in contact with them following the results of this research. So our next question, how do you overcome working with an unsupportive manager, senior team who want you out of the workplace, and colleagues who resent the reasonable adjustments you have in place due to cancer or chronic illness? And I'm looking at Julie to see whether she might want to provide comment on that.
Right. I think first of all, it is to have that conversation, and you might want to take a colleague or a friend with you into that, whether it be a colleague from your workplace, like your team, or a HR person. It's also to have the discussion that there are guidelines in place, so there are things that your employer has to do, and they might not know what they have to do. So it's actually finding out together where to go for that information. And you are a valuable member of the team. They don't want to lose your expertise. They don't want to lose all the knowledge that you've got and the team building that you've done within the workplace. So maybe enforce that, but it is a realization that nobody knows all the answers. So I think if looking back at Kate now, it's actually having that ability to say, I don't know, I will go and find out from reputable sources.
I think so, and I think, you know, from my point of view, you know, I'm a line manager, and I would much rather help and support and keep my team, you know, than risk losing them. You know, so again, it's about having those conversations. And certainly some of the things, you know, that I've done in terms of my role as a health and safety professional is spend some time with the manager to help them understand, you know, what the treatment is and the implications, and try and give them some reassurance, you know, and address some of the concerns that, you know, do come out. Oh, Julie's put her hand up. She's got an extra piece to add, so I'm going to hand back.
This is something I've found, and you mentioned places like Macmillan or Breast Cancer Care, and a lot of them will have online forums that are open to anybody to read. I found it's really useful to actually read those, because you get the information back, and what might seem a very strange or peculiar question is actually the norm. So I would use those forums to actually get some advice back and have that discussion, because they're not only people going through cancer, but they are healthcare professionals as well.
Okay, great. Thank you very much. We're racing towards the end of the webinar, but I've got two key questions that I'd like to try and get through, if we can. So the first one is, what happens when the occupational health provider and the employee do not agree with their recommendations? So I think this means that occupational health may say one thing and the employee doesn't necessarily agree with those recommendations. So I think the important thing to understand with occupational health is their advice is only that. It's advice, it's guidance. Yes, you know, they are doing that based on occupational health and medical expertise and knowledge, but it is only guidance. And again, this comes back to the point about having the conversation with the employee. You know, they will understand much, you know, clearly, you know, how they are feeling, what they feel capable of. So it's really understanding and having that conversation with the employee about what they want to do. And if there are inconsistencies between what they are suggesting and what occupational health is, you know, exploring why those are. And it may be that you need to go back to occupational health to understand, you know, the reason behind that recommendation. So it comes back to that effective communication. So the next question, some nice feedback on the webinar, thank you. But we have a listener who's actually preparing a risk assessment for a member of staff who's just had a large bowel resection due to cancer. And their question is, one major risk associated with such cancer treatment is incisional hernia, and I think the question is, can we throw more light on manual handling related to this? So one of the case studies in the research, I think, if my memory serves me correctly, was actually looking at a bowel cancer and treatment after that, and it actually specifically talks about some of the manual handling issues associated with that. So for the case study, there were particular issues for the individual in terms of actually being able to do things like stooping or crouching, and of course lifting. So I think, you know, it's certainly manual handling will be something to consider. And again, you know, this is where empowering the individual and asking them to go and have conversations with their medical professional about the risks associated with that and what they might be able to do, and how, you know, and how quickly they can resume some of their work tasks become important. So we are just about coming up to the end of the webinar. I'm just looking through the few more questions that's come through. While I do that, we've just got, because this is the first webinar that we've done looking at our research into practice, I'd really appreciate some feedback from you specifically relating to that. So I'm going to launch another poll, and I'd really appreciate you answering that just while I have a look at the last few questions, please. Okay, thank you. So I've just had a quick look through what else has come through. We've had some good suggestions in response to some of the other questions. So the question around potentially unsupportive line manager. We've had the suggestion that another suggestion for managers relating to speaking to the other work is to speak to other work colleagues when return to work is imminent by a colleague who's been receiving treatments. So again, you know, it's having those conversations and understanding the context. We've got so a good example in terms of kind of a risk-based approach for another individual who's listening, who was undergoing treatment, and they worked in an office within a hospital, and they were restricted in terms of going into clinical areas, I'm assuming because of the increase in terms of infection risk related to that. And the last question that I'm just going to mention is, what would you class an adequate adjustments to allow an employee to return to work? It's impossible to answer that in any meaningful way because it depends on the individual, and that's a key point from this research, is you need to look at the individual. But what I would highlight for those of you based in the UK is that there's very good guidance under the Equality Act about reasonable adjustments, and you can find more information and links to that guidance within our occupational health toolkit. So that just brings us up to the end of our webinar. So I'd like to thank you very much for listening. I would like to thank Julie for her support in relation to this webinar and open and honest feedback, and also to Ben for providing the technical support and pressing all the buttons while we're busy talking. So thank you very much, everyone.
Excellent. And I'd just like to say thanks to Kate for delivering the session. I thought it was very informative. We do record our sessions, so obviously this will be provided to you all over the coming days, and it'll be posted online. We'll review some of the questions and see whether there were any that we didn't get a chance to respond to, and if so, we can put something together in writing which we can post online with it. Thank you all for listening and for taking part in the polls. We hope you found it informative. So all that's left to say really is thank you, and hopefully see you at future webinars. Okay, take care.